Hello, and welcome to On-Demand Mobility and the Challenge of Access, meeting the needs of older adults and people with disabilities panel discussion. My name is Al Benedict, and I direct the Shared Use Mobility Center's online learning center and accessibility programs within the organization. For the benefit of our visually impaired participants, let me describe how I appear on the screen. I'm a white male, black hair, I'm wearing a yellow and plaid shirt, and I'm wearing black rimmed glasses. Mobility as a service promises more seamless, on-demand, and accessible travel options. The key question is for who? Panelists will discuss the physical and technology infrastructure needed to ensure that the future of mobility benefits everyone, in particular people with disabilities and older adults, who have been historically underserved by our transportation system. I'd like to introduce our panel. Jana Lynott is a senior policy advisor with AARP Public Policy Institute. Chris Pangilinan is the head of global policy for public transportation and accessibility at Uber. Anna Zivarts is the director of the Disability Mobility Initiative at Disability Rights Washington. And Bibiana Mchugh is the manager of mobility and location-based services at TriMet in Portland. A couple of housekeeping items. Please remember to use the Q&A to submit questions. And you can also turn off and on the live transcription at the bottom of the feedback window. With that, I'm going to start things off with the first question and then turn off my camera and sit back and enjoy the conversation. I'll direct this question to Jana, if you don't mind. What are some of the key physical and technology infrastructure needs for an integrated transportation system?
Okay, well, wonderful. Thank you, Al, and thanks to SUMC for organizing this wonderful summit. Let me just start. So I am a white female. I go by she, her pronouns, and I am wearing a white shirt and sitting in my husband's home office with lots of books behind me. And I moved up from the basement because I found this conference technology is really a data hog, and I wasn't getting good reception there. So really excited to be here. But in response to this question, I think it's really thinking about it from two perspectives. One is in terms of infrastructure, that we have to think about the physical infrastructure on the ground in terms of kind of those traditional what's in the public right of way. In particular, the design of our streets and sidewalks and how we manage those streets and sidewalks. But then also, and I think this is perhaps not as readily thought of as part of our infrastructure, at least in the transportation planning community, is the technology infrastructure that we need. So one of the things that I've really been pushing in my role with AARP's Public Policy Institute is the importance of open and universal data standards as a way to help create a more equitable transportation system. So hopefully we'll get into more of the detail on those at a later moment. I don't want to get too wonky in the first question, but that's really how I would frame this discussion. So should I pass it then to the next person on the panel? Let me pass that same question to Chris.
Sure, thanks. Thanks, Jana. Hi, everyone. I'm Chris Pangilinan, Asian male, short black hair in front of a red background, with a blue shirt, he, him pronouns. It's good to be here and see everybody. Yeah, it's an interesting question here about how, what is needed to bring a more about integrated transportation system that is also inclusive of all. And I think Jana's point about data and the data standards is absolutely an important one. And I think it's also interesting to kind of look back and see sort of where we are, in the broader system and how the transportation system that we've created with private automobiles at the center of it has historically been the most inaccessible and exclusive system, as well as environmentally harmful system that we've ever created. And yet it is the supreme mode that we have right now, and definitely not integrated with the rest of our system. And so I think there is some questions here that we can get into later in the discussion about how do we challenge the supremacy of this mode that is exclusive, that is not environmentally friendly, that is not integrated with the rest of the system. And then, of course, how do we avoid that same fate with the future system that we want to create, that we can make sure that it is integrated, that it is inclusive and accessible to all, including people with disabilities and older adults, and others who might be excluded from the current system. And I think there's going to be a combination of both the digital aspect of it, the data side of things, of course, but also the physical to make sure that we're bringing in physically accessible infrastructure into this space. And we can get into more of those details later on too. So with that, I will pass it on to Anna.
Take myself off mute here. Hi guys, Anna Zivarts here. I'm a white woman. I am wearing a black shirt that says Disability Mobility Initiative and a jacket over that. I have short dark hair and big thick black glasses. And I'm based here in Seattle, Washington. Disability Mobility Initiative is a program of Disability Rights Washington, and we do work across Washington State, the other Washington. And we're basically an organizing program. We believe that the folks who can't and don't drive in our state need more of a voice in transportation planning and funding decisions. And we know that a quarter of our population here in Washington State can't or doesn't drive, and yet we're often excluded from all these conversations around transportation funding and how public space gets allocated. And so, on this question of mobility as a service and mobility on demand, I think we spent the last year or so doing hundreds of surveys, hundreds of conversations with folks across our state who can't drive. And it's interesting because what we hear overwhelmingly is that, while everyone would perhaps dream of a system where they could call a number or summon a ride on an app, what we've seen is that that's just not a reality for many, many reasons, right? In many cases, accessibility isn't, wheelchair accessibility or accessibility for blind or low vision folks isn't included in the services that do exist. And most importantly, I think the real challenge is affordability. Many folks who can't or don't drive are low income because we've been excluded so much from opportunities for education and employment. And so how do we create a system that actually is going to be usable by the folks that are currently excluded in our transportation system? And I think that's really what I struggle with as we think about how do we move forward and create more environmentally and systems that are better for our public health. How do we also make sure that those systems are accessible to everyone? And I'll pass it to Bibiana.
Hi, everyone. I'm Bibiana Mchugh. I am a white female. I am wearing a blue Oxford and my hair is back, parted on the side. In the background, I have a satellite image of Mount St. Helens and a 1912 timetable from Union Station that I got in high school, which is interesting. I had no idea at that time that I would get into timetables and GTFS and schedule information. Let's see, I'd like to speak to this question with regards to the technology infrastructure. I think what we're focusing on at TriMet right now is basically a smart mobility platform that consists of data, policies, APIs, real-time information, historical information, and predicted information through machine learning. This powers many, many applications. Traffic occurrence management, basically a holistic view of the entire ecosystem across a region. Mobility as a service applications, including a multimodal trip planner. I believe that what we have seen is multimodal trip planning, chaining trips together, actually benefits people with disabilities and the low income. There's also other applications, a lot of them are emerging, such as modeling tools, service planning apps, and analytics and KPIs. But a lot of this really depends upon the underlying data infrastructure, including on-street infrastructure, TSP, sidewalk information, and things like that. So
great. If I could ask Anna, I'm sorry, Bibiana, a follow-up question. And before I do, I just want to do a shout out to her. For folks who may not realize, anytime you pick up your smartphone and you ask Google Transit or any of the other trip planning apps how to get from A to B on public transportation, Bibiana is the woman behind all of that. I really think she should be nominated for the 100 most influential individuals, women in the world, if not, in transportation. So I just feel so, it's really, for me, it's such a gift to actually be able to be on a panel with Bibiana, because she's changed our sector for the better in so many ways. So thank you. So just as a follow-up question, I've heard of TriMet's platform as being referred to as an open kind of platform, that you're trying to build more of an open mobility as a service system. And just wondering if you could describe that in a little bit more detail, and how that might be different from some of the other approaches to how we might go about bringing all the different ways we get around the community into a common system.
Well, let's see. With regards to the data platform, Open Trip Planner, we initiated that with a group of a lot of other developers back in 2019. It's an open source multimodal trip planner. It's in use worldwide. A lot of mobility as a service applications like WIM actually use it. So there's a lot of multimodal trip planners that you see out there, and little do you know, it's Open Trip Planner. There's a lot of advantages to using an open source software. I won't really get into all of them, but one of them is there's so many eyes on the code, and the development cycle is much faster. There's a lot of people all over the world working on it. And with regards to the it's not just open source software that we're interested in, it's open architecture. And we want to be able to plug and play. There's so many emerging new applications and tools and systems out there. We don't want to build multiple data platforms. We want one data platform that all of these tools can actually plug into. So it's not really open source software, it's open data standards and open architecture that we're interested in pursuing and supporting.
Thank you.
This is Anna. I have sort of a connected and related question. So one thing that we hear overwhelmingly in the folks that we talk to is, the existing sidewalk and crossing infrastructure in so many of our communities is in disrepair or non-existent. And so mapping and getting better access to information for route planning, to transit, or trying to connect to a transit provider is really challenging. I wonder if you guys have any thoughts or ideas or examples of places where that's working, or people who are starting to do more work there, not only just fixing the infrastructure, but also showing where the gaps are.
I think I could start with that. The multimodal trip planner, everything like our smart mobility platform is built on OpenStreetMap. OpenStreetMap is the only true seamless worldwide network that actually supports trip planning and multimodal trip planning. In our jurisdiction, there's metro, there's regional governments that help support it. So we have a half-time FTE that actually manages and works with the OpenStreetMap community to maintain all of these features, including sidewalk information within our 7-county area. So it's kind of a collaboration of government agencies within the region that support this. And it not only supports authoritative applications and open trip planning, but there's so many applications that use OpenStreetMap as well. So it also benefits the community as well, anyone who's using an app with OSM in it.
I wanted to ask you guys a question about kind of an extension of that. Clearly sidewalks are going to be very important as the primary mode people get around to get to and from modes. But then you've got the next level, which is hopefully transit, and perhaps there's a link of on-demand as that complements whatever Bibiana's plans are, for example, in TriMet. And so, Anna, you mentioned that affordability is an issue when we were chatting earlier about on-demand. And I think there's also, of course, the physical part of getting into and out of a vehicle that might not be wheelchair accessible. and getting more of those on board. Could you talk a little bit perhaps about, like, in your mind, like what could potentially could be an ideal scenario as we talk about mobility as a service when it comes to, fixed route transit, but also if fixed route transit isn't going to be serving that trip well, what role on-demand potentially could play, and what needs to happen to make it actually a viable option there for the disability community where it isn't today?
Yeah, this is Anna. So wow, that's tricky, right? And obviously having wheelchair accessible vehicles is a bare minimum for the blind community, ensuring that those vehicles accommodate service animals for other disabled folks as well. And then the pickup, that coordination can be really tricky if you're low vision or blind. And so how do you locate your vehicle, right? Those are all barriers. And then there's that question of, okay, so, fixed route transit we know is so much more scalable and and more affordable for jurisdictions to provide, but it's not always going to work for everyone, and people are going to need door-to-door service at times. And so how do you do that in a way that's affordable and also can work at scale? And I don't think we know the answers there. Here in Seattle, we've had a Via to Transit program pilot going for a couple of years. It's actually in the neighborhood that I'm in, and it can provide that gap to transit, that ride, but there's a lot of limitations, and also a lot of just folks who don't know about it or don't feel comfortable using the service. And so I think we're really seeing that that it's not it's not simple. And also the cost is really, for some people, $275 to get to transit is fine. For some people, that's going to make it unaffordable. And so how is that priced in a way that makes sense? One thing I'm really interested in sort of exploring more is, are there ways to provide micromobility solutions for the disabled community that could work for us? Perhaps we don't always need, some sort of e-assist to get to transit, but does it have to be a van? Could it be something that takes up less space, perhaps doesn't require a driver? Are there ways to make micromobility solutions that could work for us?
One of the exciting things happening in the industry right now is building upon the GTFS, General Transit Feed Specification, that Bibiana was really instrumental in launching, is other data specifications that do different pieces, kind of expanding upon the GTFS. So for instance, there's an effort underway right now on GTFS eligibilities and capabilities, which would allow providers to upload information about the vehicle. Is it wheelchair accessible, and other types of information that can be beneficial to the customer for having not just whether the service exists, but what level of service. And then there's the GTFS Flex, which would allow the services, demand responsive services, like those public transportation services that serve rural areas and other types of providers, to show up within the system as well. And then the third specification that was launched by the Transportation Research Board last year is called the Transactional Data Specification for Demand Responsive Transportation. And that really allows the different demand responsive providers to interoperate their services. So one of my hopes is, currently today, a lot of times these specialized services are inferior to other forms of public transportation, that you have to make a reservation 72 hours in advance. Sometimes the provider is not able to deliver the ride. But if we're able to interoperate all the different demand responsive providers in a community, then when someone makes a request into one, they can, and that provider's not able to satisfy it at the time that person wants to travel, they can open that trip request up in an automated way within the system to other providers in the community who could be able to pick it up. And, and all of those types of things are being worked on right now. But I think there's always the challenge of, within this space, what seems to be getting the most attention in the standards development are those types of features that can be profitable to companies. And so how do we make sure that this type of specification is also being worked on by the industry in a way that can really be beneficial? And I don't really have the answer to that at this point in time. Be really interested to hear what others might have to say.
Yeah, I think it's an interesting question here because of like, what is it that, and I think this gets at also Anna's point about affordability in a way too. And I'm curious, maybe Bibiana, you can have a perspective from the transit agency, and I know we're working together on that MOD project on this too, but how do you see on-demand plugging into this area here, both on the digital side, all the specifications and getting involved so that, TriMet riders are able to get to where they want to go, perhaps even mode agnostic, depending on the time of day, or they can choose fastest or whatever it might be, but also in a way that's both affordable for TriMet and people who are using perhaps, let's say, an on-demand mode, if that's the mode that's needed to get to someone, let's say, a wheelchair accessible vehicle ride, and they don't have to book paratransit 72 hours in advance, but rather can get it in 15 minutes. And that for TriMet, you're able to have a number of providers available to keep your costs down as well. Like, do you see kind of all these things blending together in a future state with transit, or how do you see those things coming together?
I think it's really a combination of things. And again, people with disabilities, what they haven't had the affordability of having is really on-demand service. On-demand service, it's so important, and to get them rides to transit or door-to-door transit, it requires an application, it requires data, it requires a lot of different facets and factors. But historically, the technology, the paratransit applications, again, you really have to call in 24 hours in advance. And people with disabilities, they have greater needs than that. And I think that we really need to step up and look at solutions, both through technology, through data, and through standards. A lot of the standards, GTFS was adopted worldwide voluntarily, which is really amazing. And one of the reasons, I think, is because it had Google Transit powering it and people saw the importance of it. And I think it's the same thing with any other standard, GTFS Flex, GTFS RT. In order for wide adoption, you really need to show the value of it. And the value of providing on-demand service to people with disabilities is probably one of the great things that we can do. It should be a focus for everyone right now.
I highly support
Anna.
that. Go ahead, Anna.
Yeah, I have a question around, I think something what we really struggle with is great, on demand would be awesome. What we've seen is that because Seattle and our whole region really has become increasingly unaffordable, there's, housing prices are just through the roof. People, many disabled and low-income people who can't afford to drive or can't drive have been priced out of areas that have reliable transit or have, even the ability to call an Uber, right? And so people are living in more rural or suburban areas where the only option is community, volunteer-driven rides, which often we saw during the pandemic just collapsed because many of the drivers were seniors themselves and, all of the COVID issues. And so how do we figure out these systems in less dense areas? There's many places in our state that are, there's like a foot ferry that goes direct from Seattle and you get off the foot ferry and you can't get an Uber. There's just no, and there's transit is minimal. How do we deal with that issue? With how to scale this beyond more dense areas?
Well, go ahead, Chris.
Oh, thanks. I was going to say, I think, it's an interesting question of how we prioritize our public transportation dollars. One, the existing ones we have today, and two, do we grow the pot? or do we shrink it? Hopefully not shrink it, but grow it. And if we are going to grow the pot and we're going to look at our priorities and spending dollars, I think the question you're asking is fantastic, which is that in an underlying way, it's almost like who is going to be benefiting from these services, which is kind of the theme of our panel here. And pre-COVID, we tended to prioritize the 9-to-5 central business district worker, right? Both for reasons that there were a lot of them going downtown in this concentrated place. It was easy to serve. But two, anyway, you know, if we don't talk about it too much, but they tend to be also the most politically active people, the ones that can advocate for themselves, right? And so now that that cohort is basically working from home almost every day these days, it's almost unearthed the other people who use transit that are just as important, that all of a sudden have a voice now, which is the people that are not necessarily going to CBD 9 to 5, but they are going suburb to suburb at 2 in the morning for an overnight job, or they might be doing, you know, another non-traditional commute job. And I think as we re-examine how we deploy our public transportation resources, I think that's going to be an important question that we ask ourselves as community members is, what are our values and how do we want to be expressing those values in our transportation system? And I suspect that we won't be putting as much money into, or like relatively speaking at least, into the old commute patterns. And hopefully we'll be able to use more of that to support people who really are in need of these transportation services that didn't have them before, whether that be those non-traditional commutes or the ones, Anna, that you mentioned in those use cases where in rural areas or less dense areas, we just haven't put the resources into making that happen, to attract those drivers or attract those services to those areas.
Yeah, I wholeheartedly agree, Chris. And I do think that it needs to start with growing that pot, especially for rural and you know, urban areas. In rural areas where it's very difficult to show, you know, turn a profit for on-demand services, we're going to have public transportation, and we just need to, you know, invest more and have more service. And, you know, there's only a handful of states that provide public transportation to every county in their state. And the rest, there are many swaths of the United States that have really no public transportation. And then if we can take that public transportation and then connect it with any other volunteer transportation through, you know, data standards, then we can start to really create that network that's necessary. But I also want to just, today there was an article in the Washington Post Metro section that was talking about how in a response to COVID, communities, you know, cities and restaurants came together and they really increased the opportunity for outdoor dining. And you know, in many ways, this has been wonderful. And it's something that certainly in our transportation circles, we tout a lot. But the article pointed out how the benefits are not evenly distributed. And actually there are some harms in the sense that even though DC had put into place strong kind of guidelines, regulations as to how this new outdoor dining would need to be designed, the implementation of it is not always consistent. And so they find that there may be chairs blocking the pedestrian access zone. There may not be ramps when they're putting the outdoor seating down in the street, ramps to enable people who use wheelchairs or other mobility devices to be able to get to that seating without going into the travel lanes to access it. So just, you know, the quote that I really thought was important to note is that the idea that restaurants were able in the span of a few months to figure out these huge challenges that COVID presented with them. But over the course of 31 years from when the ADA was passed, we haven't figured out how to make spaces accessible to people with disabilities. And the person says, I think it is particularly painful. And so I do feel like we need to center new groups of people, individuals in this planning process so that people are not further left behind, otherwise not able to benefit from the type of investments that we're making and changes to the infrastructure that we're making. So I don't know if Anna or Chris or Bibiana, if you want to kind of respond to that at all. What are you seeing in your cities?
Yeah, I can. Bibiana, go ahead.
No, go ahead.
I'll start with a response. I think, you know, the restaurant situation, it's sort of like it's a it's like a continuation of everything that's happened in the past, right? Like we have something new all of a sudden, and then we put it out there, and a lot of people can use it, but a lot of people can't use it, right? Or in the case of the sidewalks here, a lot of people might even be inconvenienced by it, not as neutral, not just couldn't use it. And I think in transportation, I think we're at a moment here as the technology is still in its infancy, and as Moss and this whole concept of on demand is still growing, that we can avoid that, or at least steer away from it if we've been steering toward it since in the last several years, by finding ways that we can work with public policymakers, transit agencies, on-demand providers to find out, and platforms, how can we use the lessons we've learned in the past to make sure we are creating a more accessible future and a more inclusive future. And to be specific with on-demand, we have some examples of policies that are being attempted to correct this. So in California, we have the Access for All Tnc Act, which helps provide some funding for wheelchair accessible vehicles county by county in the state of California. We've seen some, at least in the Bay Area, as a wheelchair accessible vehicle user myself, I've seen wait times, that have been pretty good, 10 minutes, 7 minutes, sometimes not so good, a little bit more than that. And I think it's an interesting way to see, okay, can we get waves to be a usable, wheelchair accessible vehicles, I call them waves, waves to be more usable for people, with wait times that are, on demand. And as we do that, what does it cost? What are the levers we can push and pull to bring those costs down, to make sure people with disabilities are paying the same as people without disabilities? And that maybe that technology can also be leveraged for something like paratransit or other modes where we haven't really had much innovation in the last 30 years, in those modes. And I think, Bibiana, as you said, the people with disabilities need a lot more than that, right, to live their lives. Anybody needs more than 72-hour, 24-hour reservation to live their lives. And so I'm hopeful that we can, avoid the rush to get stuff out there where we end up with the restaurant situation, the last year, which has mostly been good, but there have been those hiccups, and get to a place where really it is involving, everybody can participate.
Yeah, this is Anna. Chris, I think that hit a lot of it. I'll talk a little bit more about the sidewalk piece. I mean, I think, for those of us who can't drive, sidewalks are our highways. They're how we get around. And so, to see that space, taken up by private businesses, I think can be frustrating. And so especially, when it's blocking access and creating barriers. And so, we partnered with Seattle Department of Transportation to make a video about, best practices, but still you're going to have times when, best practices aren't followed. And it just, the whole point about the ADA, it's been, 30 plus years. And yet there are so, just thinking about our sidewalk infrastructure, and the ADA applies to a lot more than that, but so many places in our state, in our country, that are still inaccessible. And what we've seen here in Washington State is that jurisdictions are afraid to even create ADA transition plans and make those public, because they know they'll, there's a legal liability there. And so we're finally reaching the point where every jurisdiction in the state that gets state funding is going to be required to submit an ADA transition plan to the state. But we haven't even compiled those into a statewide analysis of where are we missing curb ramps? Where do we not have accessible pedestrian signals? Where are there not sidewalks? And so I think we really, it's been how long? And so we need to start to think about and actually understand the gaps that we're afraid to even measure. And so that to me is frustrating.
So I just saw that Al popped up a 9 minutes remaining for our session. So I do see a lot of really great questions that are coming in from the audience. So I think I'll just throw out one of these. The earlier session highlighted the importance of community engagement in community power and decision making, but data spec seems very techy. Is there a role, or what is the role for the community in mobility as a service? And how should MOZ developers, visionaries be engaging riders? So Bibiana, do you have any thoughts on that one?
I think that actually what we've learned with the multimodal trip planner is that you really need incentives When we first released the application, we did a lot of outreach. We did in-field shadowing, actually, with specifically people with disabilities and low income. And it's that community that really saw the value in it. You can get from door to door faster by using, say, an Uber and transit, and you can get from door to door cheaper than Uber alone. So it's kind of that community that really saw the value in it. The larger population, it's kind of interesting. They were like, well, this is nice, but when would I use it and why would I use it? And we're working on incentivizing the larger population on the use of really chaining trips together. And Anna, you brought up a really good point, though. I think that there should be more exploration around micro-mobility for people with disabilities. So that would be another interesting session sometime for some C, that question alone, I think.
Yes, and I have to admit that these micromobility devices are, they actually make me really angry, even though I see from the big picture that they have a role in our transportation system. I am so irritated that even today we are still dealing with these things being left willy-nilly, blocking sidewalks and making it difficult for people who, historically, it's individuals who have not been well served by our transportation system. All of a sudden, we throw in this new way of travel that is supposed to be this wonderful thing, and yet we're making it worse for many people in our community. So, yes, it's something we still need to talk about.
This is Anna. I have one other piece on the inclusive planning conversation. I think what we've discovered is that people who can't drive care very, very deeply about transportation access and are passionate because it's something that we think about every time we leave our homes and try to go somewhere. We are constantly reminded that the system has not been designed for us or with us in any way. And so I would encourage all of y'all who are planners to include people more because we do care, disabled people and non-drivers. I think also, the other piece is that many of us have been excluded from having any formal role in transportation planning agencies because many of those jobs have driver license requirements, even when they don't need to. Obviously you're going to need a driver's license if you're a bus driver, but if you're a planner, that isn't the case. And yet we see again and again, those are just standard in so many job listings. And so take a look at your job listings and make sure you're not excluding people who shouldn't be excluded, who have a lot of interest and capacity and passion to offer.
It's a very interesting point there, and I didn't even think about that, but that's a great one. It's a kind of a barrier that we put up unnecessarily for those jobs. And adding to the inclusive part here too, I think that on this question, and I want to combine the two questions here also about ADA paratransit as well. I think that the community, and I think you mean by community could be the disabled community, could be others, but there's a real good role in advocacy, advocating for yourself and for the community to be included. What I mean by that specifically, I really am passionate about the idea that on-demand can revolutionize paratransit. This is something that kind of a seed that's grown in my head the last 2 years, and just seeing some agencies try it out, like in Boston and in Denver, is really exciting. I think it can change people's lives. And I think if you live in a community that doesn't have that today, working with your transit agency or working with your local representatives to ask, why not us? How can we get this here? And I think on the question right below it about ADA services and what are the barriers keeping shared mobility modes from getting more into paratransit, I think there's a real good question about looking at the way that we define paratransit. The circular and the way that we define ADA paratransit was written out of the 1990 law, which at the time we didn't have any of these other modes available or technology. And I think it's useful to ask the question, how do we want to define paratransit today? What are our performance metrics and funding mechanisms and all that go involved into it? And can we create a better system while still having the great things that came out of the system in 1990? I think the answer is yes. And I think we need to get on that as soon as we can.
All right. So let me ask another question as follow-up that Judy Shanley talks about the silo between the federal highways folks who are responsible for kind of that physical infrastructure of sidewalks and transit stop accessibility. She says FTA authority, although I would say that that is often a public works, local public works responsibility for making sure the sidewalks are accessible as well. But how do you bring these different parties that are kind of out there siloed together to really work on these issues to solve them once and for all? You know, particularly, how do we bring them together under the umbrella of the mobility as a service discussions? Any quick thoughts? Because I see Al has popped back on, which means we have 2 minutes left in our session.
I want to hear this answered, so this is great.
Yeah,
I don't have an answer politically, but I know that this is something. One of the people we work a lot with is Crystal Montero. She's from Tacoma, and you know, talks about how that so often her wheelchair stops are gravel or not. You know, there's no sidewalk, or they're too steep for the bus to let her off. You know, and for her, she's like, sidewalks. They and transit absolutely are connected, and we have to stop thinking about them as separate things. And so I don't know what the political solution is, but I think it's imperative that we start to draw those connections.
Yeah, I've seen it work well under, you know, agencies that are combined, like SFMTA, where it's the trans agency and the DOT together. But when that's not the case, if they're separate county, state organizations, you know, you need either the community to be advocating hard for it, or a representative and the agencies to come together and make this a priority, because it has to be, you know, one and the same. It can't be separate anymore.
And I think Montgomery County, Maryland did that, even though they were different agencies, you know, entities upon themselves. They did their bus stop analysis in basically bringing the, you know, representatives from each of the agencies together to go out and do kind of a bus stop survey, you know, on the ground in order to, you know, identify what are the problems, what are the solutions, and then put money behind solving those problems. So, and I believe it was, you know, relatively successful, although I don't think any jurisdiction can claim they have completely made every bus stop accessible in their county.
Well, I think, you know, yeah, the complete trip is definitely an important factor in all of this, and in MAS and in mobility, considering everyone, you know, considering all mobility options. And I'd like to thank everyone for a great panel discussion. This was awesome. I was sitting back listening, and I loved it.